All right, all this week, a Street Smart special series, Working It Out. We're looking at what corporate America is doing to create a healthier workforce and what companies stand to benefit. Corporate wellness programs are also spawning new industries like the so-called pay-for-prevention business, which designs plans that pay people to stay healthy. Virgin HealthMiles, a part of Sir Richard Branson's Virgin Group, is a 4-year-old health incentive management company that has created wellness programs for Papa John's International, the pizza company, Timberland, the shoemaker, and Maidenform Brands, which makes garments. Joining us to talk about this, Sean Forbes, president of Virgin HealthMiles. Sean, thanks for joining us. Appreciate the time here. Let's talk about first how your program or programs work. I mean, what are people paying for, what are companies paying for, and what do companies get?
Sure. I mean, we're creating the good driver discount for health insurance. So we're helping employers drive down preventable health care claims cost by putting a system in place for them that allows them to pay their employees for healthy habits, up to $2,500 a year in a combination of either cash or premium shifts, offsetting premium shifts between active participants in the program and non-participants.
Well, Sean, let me ask you, too, in terms of the new health care law, I mean, is that going to make a significant difference in your business?
You know, it will. Previous to the Affordable Care Act, employers could only offset up to 20% of an employee's premium based on participation in preventative health programs, not just programs and diet programs, but HRAs and annual physicals and the like. With the ACA, that amount goes up to 30%. And I think the government's signaling us the direction is going to go higher. There's a provision in the bill that it can go up to 50% in 2014. So that's helpful to us because it means that our self-insured clients can increase the amount of incentive for their employees to use the program.
I wonder, I always wonder when talking about health care, I will go to the gym and start a program, and then it just doesn't turn out to last so long. I don't know if I'm representative of everybody, but how do you get people to stay in long-term in these programs?
Sure. A couple things. First, the cash is pretty powerful. I mean, up to a $2,500 reward or a discount on your premiums in the next year is pretty powerful, especially when you consider it in the light of the potential to actually have a premium increase if you don't participate in preventative health care programs. But, what we hear from our clients that have been on the program for years is that the money is secondary to the social connections that they form via the viral network that's formed around Virgin HealthMiles. We have 650,000 people on the program across the U.S., and they interact with each other, meet new people, much like Facebook, chat, and have competitions amongst each other on activity. And over time, this creates long-term behavior changes. And what we find in our surveys of our end users is they don't want to let their new friends and their peers down by coming off the new pace that they've set.
Sean, just got about 20 seconds here. I mean, I've seen this industry, the pay-for-prevention, described as the fledgling pay-for-prevention industry. Do you buy that, or do you really see that this is going to be a bigger and bigger part? Let's say for Virgin, is this going to be a bigger source of revenue, just quickly?
No, it's not. It's going to be very big. I mean, we're reestablishing the levers of cause and effect between personal behaviors and the costs, the preventative claims costs that come out of them. I mean, the preventative claims costs are going up by, more than 10% a year. They've doubled in the last 20 years. This is going to be a big industry and turning it back around.